Popliteal fossa. In this short video, I'm going to discuss about the anatomy of the popliteal fossa. Popliteal fossa is located behind the knee joint, lower third of the femur, and upper part of the tibia. It is an intermuscular space. What are the fascial covering of the popliteal fossa? Superficially, it contains superficial fascia, which consists of little fat, and deep fascia beneath it derived from the fascia lata of the thigh and the crural fascia of the leg. Deep fascia is thin and strong, and it firmly bound to the tendons which form the boundaries of the popliteal fossa. What are the boundaries of the popliteal fossa? So it has four boundaries. In this picture, this is the lateral side, this is the medial side. So we can set these four boundaries as upper lateral, upper medial, lower lateral, and lower medial. So you can see this upper lateral boundary is formed by the biceps femoris. Upper medial boundary is formed by the semimembranosus and semitendinosus. Lower lateral and lower medial two boundaries are formed by the lateral and medial heads of the gastrocnemius muscle. So what are the structures from the roof or the posterior wall and the floor or the anterior wall of this popliteal fossa? Roof or the posterior wall formed by the deep fascia, which is fascia lata, and crural fascia of the leg, and this posterior wall or the roof pierced by the small saphenous vein, it drains into the popliteal vein, and the posterior femoral cutaneous nerve. Floor is formed by the popliteal surface of the femur, knee joint capsule, which is reinforced by this oblique popliteal ligament, and the popliteus muscle and its covering fascia. What are the contents of the popliteal fossa? It contains the tibial nerve and common peroneal nerve, which are the branches of the sciatic nerve, and then we have popliteal vein and its tributaries and popliteal artery and its branches. Not only that, popliteal fossa contain popliteal lymph nodes along the popliteal vein. What is the clinical relevance of this region? If you happen to diagnose or examine a lump in this region, you can come up with differential diagnosis. So this lump could be due to skin and soft tissue such as sebaceous cyst, lipoma or sarcoma, or it can be from vein like varicosities of the short saphenous vein, and could be arterial origin such as popliteal aneurysm. It also could be due to knee joint pathologies such as effusions, Baker's cyst, and then bone, underlying bone also can give rise to lump in the popliteal fossa region such as tumor of the lower end of the femur or upper end of tibia. And then tendons also can give rise to lumps such as enlarged bursae beneath the semimembranosus and heads of gastrocnemius, and also lymph adenopathies also can give rise to lump in the popliteal fossa region such as infection due to suppuration in the foot. Thank you. Stay tuned with Anatomy Everywhere YouTube channel.